Oh, welcome, David Miller, Dr. David Miller, aka the Gut Gangsta.
Thank you. I might have to change my name. I'm 40 now, so I might have to change my name at some point. But for now, I'm the Gut Gangster.
Ooh, any ideas on what it would be?
Maybe the Gut Whisperer.
Right, as you
I
start.
don't know.
Yeah, as your maturity allows you to calm down and
Yeah.
Uh-huh.
Yeah.
Uh-huh.
As the wisdom goes up and the testosterone goes down.
Yeah, it's like less
yeah.
gangsta, more gut whisperer, gut massager. Because we were talking before we started recording on, we're going to talk about the gut-brain connection. And we're talking about how maybe I'm more of a top-down, so brain to gut or brain to butt, and you're more of a of a bottom-up. So
Yeah, butt to brain.
So we might be treating the same problem, but literally from different perspectives.
Yeah, but the both are important, right? And maybe as sort of evidenced by like the vagus nerve is probably something. Do you talk about the vagus nerve a lot? I would imagine you do.
I talk about a lot with patients, but we have not talked about the vagus nerve in this podcast yet. So let's
really
dive in. Yeah, I don't think
so. I'm not an expert in the vagus nerve per se, but what I've noticed, I thought was really interesting to talk about with you, because lately I've seen a lot of like vagal symptoms. So like you're flushing, or you get symptoms of like thirst or hypotension, where you feel like your blood pressure drops. What else? Like problems with hunger, all the stuff that we talk. I mean, hopefully your audience knows a little bit of your lingo, but like in naturopathic medicine or Chinese medicine, we'll talk about like that stomach yin deficiency, where you have like this niggling appetite where you just want to eat a little bit, but if you eat too much, it hurts. What other sort of vagus symptoms am I seeing?
You're talking about like vagus overstimulation or vagus understimulation?
I will just say dysregulation. I won't even specify. There's just something irritating the vagus nerve sensory aspect coming up from the stomach a lot of the time. And so I thought it'd be a great place to start with just talking about the stomach and that vagus nerve connection, because it's so important. And that takes off some of the heat, like we were saying before we got recording. Sometimes taking off some of the heat from like noxious stimulus from bottom up can just free up your mind to deal with the other things that I can't fix.
Right, like you were saying, like maybe you're married to the wrong person, but that's not really my zone of expertise. So what I can do is take the stress off your body by removing the organ stress that may be contributing to the general stress picture, and then maybe now you have more resources to deal with the other stuff.
Exactly, and it's pretty modest sort of expectations, but that's good, because I'd rather under promise and over deliver. But I do see often even just simple stuff like one of the things I'm prescribing almost all the time now is like DGL or slippery elm, because when you calm down the tissues of the stomach, even that can sometimes decrease the, again, noxious sort of stimulus going from the stomach vagus nerve up into the central nervous system. So really basic stuff like DGL, not a real sexy thing, that's like an 80s supplement,
It's delicious, and it comes in lozenges that taste like chocolate coconut.
Exactly.
One time I ate a whole bottle, so I'll always tell people you cannot overdose on this. I've tried to.
But it's like, yeah, it's delicious. It's so compliance, we struggle sometimes with like compliance with some things, but that's an easy one, and it's an easy win now that I know what to look for in terms of like stomach irritation and how that may have implications on like anxiety, like just taking a little bit of the edge off.
Yeah,
that's pretty cool. It's not something we sort of generally think about. We'll think about like L-theanine or GABA or all these nervines, but it's sort of like a way of looking at how the organs affect the brain and then affecting the organs.
Yeah, because it's kind of like chicken and egg. When a patient comes in with their main concern being anxiety, they'll say, I often don't have an appetite, especially in the morning, or I feel nauseous.
Yeah.
A lot of these blood sugar kind of symptoms. And I'm looking at that from a blood sugar perspective, and then I'm telling them to eat anyways. But, it could be coming from the gut, or a significant amount of stress input could be coming from gut inflammation, is what you're saying.
Yeah, some of it. And that's what, I'm always hesitant to say like it's all this. That's I think we have this problem in our in society right now. It's like we have this black and white binary thinking like it's all this, it's all that. But at least accepting that there may be a contribution of structural or tissue uh stimulus from that organ going up that is contributing to some degree, Talia. Like
Mm.
again, we don't always know exactly how much, but I think that's what I'm trying to bring to my practice, and hopefully at some point to the profession, to sort of integrate this idea of structure and function in the gut are huge. And I'm not just talking about structure of cells. I'm talking about like the positions of organs and their ligamentous connections. Like, for example, we in TCM or in Chinese medicine, we talk about the stomach spleen connection. And it's
Mm-hmm.
probably one of those ones where you're like, what do you mean spleen and digestion? Like, it doesn't make sense.
Right.
I don't know if it didn't make sense to you, but the spleen is like it's like a lymph organ.
Yeah, like holds blood, and it's bad if you rupture it, but other than that, you can just take it out and go on about your day.
So it's one of those ones where you have this sort of disconnect between like Western anatomical sort of basic knowledge and then like this Eastern idea of like, ooh, it affects the digestion. Well, I'm seeing a lot of problems with the spleen pulling on the stomach, and because the stomach is connected through the gastrosplenic ligament to the spleen. And it's interesting, you're like a lot of these connections that we have, not perfect. We don't make the perfect connection, I don't think, in school between the Western anatomical and then the Eastern sort of old wisdom. Some of them I was like, what, really? That doesn't make sense. But this is one of those ones I'm like, yeah, it actually does make sense. I'm seeing spleen ligament pulling on the stomach, and then you have digestive issues. So there's the link between spleen and digestion.
Do you see there being an immune link? Like, is there something, an issue with the spleen in terms of maybe it's engorged or there isn't enough lymphatic flow?
Could be. I'm not at that level
Mm.
yet. I hope to be. I'll be really good when I'm 80, I say. But
Yeah, when
but
you're
there is a
full on
link
gut
there.
whisperer. Yeah.
Yeah, exactly. Yeah. Um but yeah, that's and there's other, like, I've noticed some other links, as because part of what I do is sort of borrowed from osteopathy, right? So I do a kind of it's called listening with your hands, and you can feel restrictions, and you can feel fascial tensions, and you wouldn't believe how many of them are completely related to acupuncture points. That you're probably like, okay, I'll do this point, yeah, I get it, traditionally we've accepted that that's a thing. But then when you have the ability with your hands to feel the connection between like stomach and then stomach 36, that
Mm.
acupuncture point, it's like a new kind of reverence for that old medicine.
Right. Well, it was really observational, and so I think I've seen the spleen, the Chinese spleen, equated to the pancreas, like the Western pancreas, but then it's still called the spleen. So you're right. It doesn't fully explain. It's not like, oh, they just got the name wrong, you know?
Yeah, but it's
Um,
also, guess what, connected to the stomach. Like the pancreas, so actually pancreas is difficult to treat kind of with what I do, because it's like 80% to um well, I don't know if it's 80%, but it's halfway between basically anterior and posterior parts of the body. So I have to feel through things to feel it.
mm,
And but it's basically right behind the stomach, and it kind of it's like a wimpy organ. We got a couple wimpy organs, like the pancreas and the thyroid are sort of like, they're wimpy. And
but mighty. they
but so important.
making so many chemicals. They're those chemical factories.
Yeah, they're so important, but they don't have capsules, right? So
Mm,
they're kind of like
smushy.
susceptible. Yeah, they're mushy. They're
Yeah.
squishy. Yeah.
Squishy orange. Yeah, so they're protected. They're right in the middle. Well, not the thyroid. Thyroid's right on the outside. But and when we're talking about spleen, what we're talking about basically in Chinese medicine, it's the organ that digests and assimilates our food, that creates energy out of the food we eat.
Yeah, and generally you'd say like someone with a weak spleen energy, if we're talking like TCM, or like a spleen G deficiency or spleen deficiency, would be someone who's like a little puffy, lymphatic person, maybe has some food allergies that lead to low grade chronic inflammation and that sort of stuff. So I always had a tough time, like I said, linking that spleen. I'm like, well, come on, like all the other ones sort of make sense.
Yeah. Yeah,
So
I am the spleen she.
yeah,
My MO for so long. Yeah, it's my first diagnosis, and I was like, whoa, this makes a lot of sense.
yeah, yeah.
Mhm.
So
Yeah. Can you talk about, oh,
sorry,
go
go
ahead.
on.
No, I was going to ask if you could tell us a little bit about the vagus nerve. We've been throwing the term around, but in terms of, what is this nerve and how's it relevant to gut-brain connection?
Yeah, so I guess it did start along that. I didn't really fully complete that, but basically, it's a cranial nerve. Vagus means wandering. So that's the Latin
Oh,
origin of it, which is really cool because it does sort of wander.
like
Uh,
vagabond nerve?
yeah, it's a vagabond, basically. Yeah, it wanders, and one of the places it wanders from, like we're talking the cranial nerve, so we're talking high brain centers. Um, it wanders all the way through the digestive tract up until the descending colon. So it's innervating every aspect of digestion, that's why I think it's a good model or like microcosm of the gut brain connection in a
Mm-hmm.
way, because it's got that sensory and effector
Mm-hmm.
ability. I forget the ratio. It's not 50-50. I think it's like 70-30 or
I think
something like that.
you're talking about afferent to efferent. I think it's 80
Yeah,
20 and 80
80-20,
20
70-30, something like that.
afferent. Yeah. So I think
Yeah.
80% of its impulses come from the gut to the brain.
So that tells you the bottom up is probably relevant to some degree. And I think with what we learned in school, I didn't really know how to affect the vagus nerve, like other than like nervines and stuff like that. But the vagus nerve is so important for our basically our parasympathetic rest and digest state. Is that
Mm.
like a good little brief
Yeah.
overview?
Yeah, like we've heard of things like, the EFT tapping, where you start tapping different points where the vagus nerve may be more superficial, so like kind of forehead and collarbone, and then there's the gargling and that kind of
Yeah.
ujjayi yoga breath to the back of the throat. I think it goes down, and it's yeah, like we talk about the parasympathetic nervous system, the rest and digest arm versus fight or flight. So this idea that it might be, I guess, overactive. I don't know, these terms you might not agree with, but overactive in sort of like that shutdown, that freeze response,
Yeah.
and then underactive in a high sympathetic arousal, so like active anxiety, panic, that kind of thing. Um, and there's been like herbalists I've listened to, like people like Matthew Wood, have said taking bitters can help with panic attacks because it activates the vagus nerve. It kind of stimulates digestion. So I've been working, again, that's top down ish, because we're trying to manage panic by involving the gut and the vagus nerve. But I think it's really interesting when you're talking about, let's go straight for, let's look at what organs could be contributing to your overall stress load.
Hmm. Yeah, no, I think if you're talking about bitters for anxiety, I think that's actually what I think it's like you're doing what I'm talking about. Like you're trying to change the environment of the organ so as to have a sort of like a boomerang effect coming up. And I think that is what you're doing probably. And yeah, just a little shout out to the esophagus, because I think you brought up the esophagus there. Like if you have esophageal like issues, like swallowing issues, or like there's like you get some sort of weird feeling in the back of your throat, I urge everyone and every practitioner to think about the stomach. The stomach and the esophagus are like they're 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 twins. They're like brother and sister, and a lot of stomach issues show up through the esophageal problems, and the both branches of the vagus nerve are going through they travel along the esophagus. So it's a
Mm-hmm.
great indication, and that's probably why the gargling is a huge factor too. So
Mm-hmm. It's like gargling for panic has this kind of this calming effect.
mhm.
Yeah. Kind of a weird thing to do if you're on the verge of a panic attack and then you just grab some water and start gargling. Get some.
It is kind of weird, but it would at least it focus your energy on something. I've
Oh
had
yeah,
one
it takes
panic
your
attack.
mind off. Yeah, whatever. What the
I don't
presentation
want
you're
any
about to
more.
deliver. Yeah, exactly. Yeah.
I would gargle. It would be that's a good idea.
Or you just start throat singing right before your presentation. This is how I get ready to perform. Yeah. Well, and you said you start looking for signs of gastric inflammation. And I mean, what I think is interesting is a lot of our questions, so you can ask somebody, like, do you have any stomach pain? Do you have any cramps, bloating? And a lot of people will say no. And then you start getting in there, maybe performing a physical exam, you start noticing immediately that there's something going on. So what
Mm.
sort of things you look for to assess gastric inflammation or suspect that?
So, in addition to hands-on work, which which has informed my practice. Like it's a whole new world of wisdom that whereas I would look at some symptoms before as a pretty good guess, now I put my hands on, I'm like, yep, there it is. So it really helps confirm those guesses. But some of those guesses, or like clinically informed, experienced hypothesis, isn't more. It's better than a guess. Those would be like any issues with the throat and swallowing. Those are implicating the stomach to some degree. Obviously reflux, I mean, that's an easy one, and it's actually an easy win a lot of the time. Reflux and hiatal hernia, you can have a lot of effect with hands-on, or maybe some acupuncture um, points. Those are sometimes an easy win. Thirst and hunger and appetite, sort of strange things that happen, like if you're thirsty all the time, which again, Chinese medicine, right? Stomach yin deficiency, or whatever, they're gonna be thirsty. And then that niggling appetite, that sort of like gnawing appetite that you want to eat something little all the time, but not a whole lot at once. If you eat too much at once, which tells you what, like, if okay, so let me just back up a bit. We talk about microstructural changes or microstructural damages in naturopathic medicine a lot, like using glutamine to support the colonocytes and enterocytes, so that they have the leaky gut is addressed by
So like
giving them the
feed the
fuel.
gut cells.
Exactly. So we talk about that microstructure, but we don't talk about is the macro. So if we're gonna, I'd like to be able to introduce that term now, so that if I talk about it, you know what I'm you know what I'm saying, kind of. So sort of like it's a perspective that you take, sort of like someone with a microscope isn't wrong, someone with a telescope isn't wrong. They're both right from a certain perspective. So when I say like the integrity of the tissues and the mucosa of the stomach or the intestines, that's like a micro view. Whereas when I say the position and movement of the organ in the body, sort of anatomically, that's more of like a macro view.
Right. It's like, oh, that's
Um,
not a house, it's a pile of bricks. You're like, well, it on the
yeah,
one hand it could be, yeah.
exactly. Thank you. That's it. I love analogies, and you've just added to my repertoire. Thank you. Um, yeah, so it's kind of like the macro view has been, I think, an oversight, if I'm just brutally honest, in our sort of training. And our training is awesome. Like, I think our ability as a naturopath to take different perspectives is one of the greatest things about what we do, and that's why functional medicine has imitated everything we do and tried to refine it. So, a little shout out to naturopathic medicine. But I'm a uh, I think we could do better with the macro evaluation. So why was I bringing that up? Well, when you eat a big meal, that implies there's some macro. There's probably a macro structural change going on. When we eat, it's going to stretch the stomach as a whole. Yes, there could be micro sort of tears or tissue changes happening too. So it's not a perfect example, but a better example would be in when someone has a change of position of their body. I mean, you're not changing the microstructure too much. That's not a microstructural evaluation. But if someone in a certain like yoga position, for example, feels an alleviation or aggravation of symptoms, you have to think about the macrostructural component. So that's a good example of thinking about the macro structural.
Like when people are told to move or to go for a walk to help with constipation, we're thinking,
Again,
yeah.
exactly. And there couldn't be both. It doesn't negate the possibility that when you go for a walk, there's a little bit more blood flow and all that as well. It doesn't negate that, but it's a perspective that has like totally blown my mind in terms of like being missing in our beautiful medicine to some degree. Although I know there's some people that do evaluate structures a lot more. Than maybe what we were trained to do. But I feel like it's something the profession needs to borrow a little bit more from like the osteopathic profession. And we're perfectly set to do it because we can integrate it with all the other views we have, all the other perspectives we're able to take.
And
So
more that hands-on. How did you start getting into that? Like what sort of led you into focusing more on the structural and on the hands-on therapies?
yeah, Well, I think I knew it was missing, right? So I'm sort of like philosopher type person, and I think of like, imagine you were a physiotherapist and you never touched anyone's knee, and someone came in and said, "I have knee pain," and you just sat there with your legs crossed on the psychiatrist's couch and said, "You know what? I think it's medial meniscus from these symptoms." You never touched them. And I
Mm.
was like, there's something missing here. Like, I know it's hard to touch guts. It's going to be more difficult because they're sort of hidden, they're deep, they're squishy, and sort of this unknown zone. And so I knew there had to be something. So I took a couple of like courses that led me closer and closer to what I think is the best sort of evaluation of the guts from a integrating it into a physical exam, because that's what I've done. I've integrated the osteopathic into the physical exam, and it just, Talia, it sheds so much more light on gut issues. And I'm just eternally grateful for Jean-Pierre Barral, who's the French osteopath who knew enough to look deeper into that area. And so I did the Barral Institute training for visceral manipulation, and it's been the best thing for me and my patients. And I hope when I get, when I get even better at it, I'd like to bring it back a little bit to like integrate some of the nectar into what we do for a physical exam. Because I don't know if you remember doing like abdominal physical exam, but it's pretty lame, I have to
Yeah.
say.
It's one of the physical exams I do the most, I would say.
Mm-hmm.
Because it does feel like with just symptoms, you can't tell a whole lot when it comes to the gut. Like symptoms tell us so much, but when it comes to gut symptoms, a lot of us just live with bloating 24/7.
Yep.
So it's hard to subjectively know if you're bloated, and then you do some percussion, and then all of a sudden you hear it's like an
Yep.
empty drum. You're like, okay, there's some air in there. But that's it. It's listening, percussion, palpation. That's my
Yeah.
repertoire essentially.
But that's good that you do it. Like, and I always give a shout out to any naturopath doing physical exam, because again, it's an easy sort of thing to not do. It can easily fall by the wayside. So like you and anyone else naturopath who's doing physical exams, good, keep doing it. I just felt like when I did it, I didn't get actionable, precise information. Be like, oh, it's tender. Well, great. What is actually tender?
Mm-hmm.
And we couldn't always you can't always figure it out. We're told, when I see a report from like a doctor that says liver not palpable, I'm like, that's it's wrong. I palpate everyone's liver every single time. So it's just like,
And
it's
me too, because that we were told that that's normal. If you can't palpate the liver, good, it's not enlarged. So carry on with your day.
yeah. And that's one aspect of naturopathic medicine. I think we borrowed a lot from the conventional medicine. I think we followed just like the basic, medical doctor um evaluation of the abdomen. And if someone's really good, like there's freaks out there, and I'm just saying, like, maybe I was just an average student and I felt like I wanted to know more. Maybe there's freaks out there that they can feel everything, but like, you can feel everyone's inferior border of the liver, you can feel everyone's gallbladder if they have one, you
Mm-hmm.
can feel the edges of the stomach, you can feel the colon. It's so easy to feel. You can feel all these things. And I felt like when I did my percussion or whatever, I was like, yeah, this quadrant it feels not so great. It's like, I can't really, that's not actionable.
Right.
So
Right. Yeah, because you're sort of saying, okay, is it fecal impaction, or is it small intestine bloating? Is it very general directions? It's sort of like when you see a farmhouse, turn left maybe.
yeah, it's diffuse, right? It's not precise. And I feel like you'd never be able to feel any sort of you wouldn't be able to feel I feel the kidneys all the time. If,
Mm,
like, and like we were told, basically you can't really feel them.
right.
And so I'm
You like
like I said,
punch them through that. That's the test for.
yeah, exactly. Which is
Mhm.
still relevant, right? That's
Mhm.
still a good test. It's not again, I'm not about throwing throwing out all the things we learned. It's just we could get better with this aspect. And I think I knew it was missing. So back to your question, I knew it was missing. So I searched and searched for the best possible answer, and that was it. The visceral manipulation is totally changed my practice and my confidence in my results. Like when someone like when someone comes and sees me with a gut problem, I can say I'm pretty confident that we're going to get some insight from the physical aspect and from the physical treatment. I'm pretty confident now that we're going to get some results. Like, I'm just being honest, right? I'm brutally honest. Like, I didn't have that confidence in the past when we rely on probiotics, some fiber, maybe like homeopathic, some herbs. Like, I love them. I still use them, but I use them way more informed now. And like we were talking about DGL, like
Mm.
now when I use DGL, I'm pretty damn sure that it's going to impart some benefit. So
It's true. Like with gut stuff, it feels like a lot of guesswork. And I think then we defer to testing. And even choosing the right test is difficult. Like, do I do a stool culture? Do I do something like biome? Do I do a SIBO test? Do I do like a food sensitivity test? And then your patients might be out $1,000 if you go down all those routes.
exactly. And like, again, they're not, I've danced around doing another post about this sort of test, don't guess mentality. And there's nuance to that. And there's some tests that I think are like so irreplaceable, and probably core to maybe figuring out more serious things, or more things that really need to be investigated a little bit more deeply. But I think the other side of the don't guess, the test, that's fine, but the don't guess side of it is the problem. I'm not guessing, right? I'm You might be the type who wants to just put everyone on, like, you do a stool, like you said, you could spend thousands. Let's do a food sensitivity test. Okay, let's do a stool culture. Okay, let's do my biome or whatever. And it's like, how much actionable, precise information do you get from that? I would argue, as a fairly experienced person, that you don't get a ton all the time. And a lot of the stuff you decide to do would be sort of generalized interventions anyway. So the don't guess part is the part that I don't mean to ruffle too many feathers, but I'm not guessing. I'm
Mm.
listening with my hands and putting the whole picture together, and that means my guess is probably better than most. So that means I don't test very much.
Mhm. Well, yeah, it's like the way that a clinician, that's the art of medicine. It's the way the clinician listens and then synthesizes the information in a kind of Sherlock Holmes way. It's like the more
Yeah.
experience you have, the more you start noticing the nuance, and you look for things. Like, I'm working right now with a startup, and they're asking me to do some health assessments, and they're sort of like, well, why do you want to ask about medications? And I'm like, well, I just need to know. like the data analytic people are like they want to understand the data. Like, why am I asking?
Yeah.
I'm like, I don't know. I just need to know. Well, so then I have to start justifying why I need to know medication. There's justifications obviously for that, but it's like, well, I mean, I'm thinking of the patient who's on a blood pressure medication, and you're asking me how to assess their risk for a mental health condition. I'm like, well, there's just a sense you get, and it's not based on some woo thing. It's just experience that you start to accumulate as you meet so many people and you start to see patterns.
Mm-hmm.
And you're looking for like really nuanced information at the physical level too.
Yeah. So I mean, I think there's so much information there that's just um, not being interpreted, or not being um, heard in the right way, until we get really good with our hands, because the body tells us stuff. Just like, when you're taking the case and you want to know the medications. Well, of course you want to know the medications. I mean,
Right.
yes, it's
Yeah.
very. I mean, they have a huge impact on people's physiology.
Right.
What is less understood is that the organs of the abdomen actually move, right? And so movement is key. I use pretty loose analogies sometimes, but like, would you rather get your water from a waterfall or a swamp? Like, things need to move, and that applies to the organs too. And this whole idea of organs moving and being in the right position um, is kind of, yeah, it's kind of not, it's not as, I can't believe it's not more known. When you, what's like being a naturopath, like, you walk around, like, come on, of course, like, didn't you know sleeping and food might have an effect on you?
Yeah, right. Yeah. Someone was like, oh, I didn't realize that like sleep issues were a risk factor for depression. I was like, isn't that just that's just like you
Yeah.
pluck that one right out of the sky? Like that one just is there. It's like written in graffiti, isn't it?
Yeah, exactly. So I feel like that same sort of thing has happened with this. It's like, well, of course the organs are contributing to these symptoms. So
Yeah. What
yeah.
do you feel? Like I'm really curious, right? Like because I think I've seen your Instagram posts and how you're talking about like things that the information that you glean from like that physical analysis. And I mean, I've definitely done abdominal exams where there were these interesting things that I couldn't put together because I just didn't have that specific training. Like a patient who had some sort of like IBS and had very smushy organs. Like I'm used to some sort of abdominal rigidity with
Yeah.
the muscles of the abdomen, and hers it just kind of sunk right in. I feel like there were no muscles there. It's like kind of tissue paper. And she wasn't an elderly person. She was sort of like in her 30s, 40s, I think. And it was just very interesting. I was like, huh, there's something going on here with this like integrity of the muscles. Um, I'm wondering is the things that you pay attention to and feel.
So what you're doing is, but you might have a bit of a knack already with it. Like um, that sort of thing is not really. So you're feeling something with your hands. You're feeling like a difference in terms of what they're picking up. And as you tune that organ, you can start to differentiate different sorts of sensations. Like I'm getting to the point now where I feel crazy kind of when I feel it, because I'm only a couple years into it, right? And I think it's a lifelong learning. And I feel like I can feel nerves kind of now. Like if there's like nervous energy, it feels kind of electrical. And a lot of the stuff is very, it's sort of intuitive. Like I took another, like an osteopathic class it's called listening. It's how to like listen with your hands, and what different structures feel like is exactly what you'd probably think they feel like. Like a bone feels a little more solid, and you can connect. This is the difficult part that I haven't heard them. They haven't given me a good answer at the course because I ask questions all the time. But it's like, how do I feel through? Yeah, how do I feel through different tissues, but still feel that thing on the other end of the tissues? I think there's just a communication between the tissues, right? So, um, sort of like yeah, like you can feel the skin, and then you feel the subcutaneous layer of it, and then that communicates with the fat below it, and then that communicates maybe with the bone. But you can feel the bone if you put your mind. You're like, I'm trying to feel the bone. You can feel it, and they do feel like intuitively how you think they would feel. Now, like I said, I'm sort of new to this, so I would love to hear what someone like Baral would say. 84-year-old guy who's been doing this. He wrote the book, literally many books, and but they are intuitively what you think they feel like. Like the stomach feels quite sort of airy,
Mm.
and the liver's kind of
Gurgly.
like it is, and lots of sounds happen in this clinic because things do gurgle when you start moving them around. But the liver's a little like thicker and like thicker gelatinous. The large intestine feels kind of like a pumped up, like a half pumped up bike tube. The small intestines are pretty gooey, like pretty soft. The gallbladder feels like a little, like a bulb that you like on your otoscope or whatever. It
Uh-huh, uh-huh.
They feel like
Turkey
how
baster.
you, yeah, or turkey baster, yes.
Yeah.
So they feel like sort of how you think they would feel.
Right.
Um,
What's your favorite
yeah,
organ to palpate?
that's a good one. My favorite, you know, at this point, because I'm getting good, but I'm still like very much so a student. Probably the colon, because it's easy. It's easy to it's an easy one to start on. It's like a bike tube, and you can move it, and like this really helps with, I think, patient care too, because so I've applied the osteopathic sort of listening and integrate it into my physical exams. So like I'm getting a communication with the patient that is awesome for both of us. I'm getting great information, and I'll ask them as I feel things, what if we do this? What if we move it this way? What if we move it this way? What if we move it this way? How do you feel? And they make some connections in their body that they wouldn't otherwise. And so I feel like I started that mostly with the large intestine because it's pretty close to the anterior surface, so you can feel it fairly well, at least on the ascending side, on the right side, and then less so on the descending side that leads to the rectum. But that was funny that I said "but" there. But anyway, you
In
can
other words.
you can feel that one fairly easily, and then if someone's constipated, you're probably going to get some benefit there.
It's interesting because so much, I mean, yeah, like I really, as you had that analogy with the physiotherapist who's just listening, like hearing you talk about your knee and then giving you a diagnosis. And it really feels like that a lot of the time. I don't think it's just us, it's gastroenterologists, it's everybody, unless you're doing colonoscopies and ultrasounds or imaging. It's sort of like you skip past the physical assessment. And it's like a lot of chronic diarrhea is actually chronic constipation with fecal impaction, and being able to feel fatty liver and yeah, like that's really useful to be able to get into the organs and actually understand what's happening with them, rather than just like trying to backtrack from a symptom.
Yeah. Well, I mean, we talk on the podcast that me and Dr. Kara do. We talk a lot about how assessment is really so key to getting a good result. Like if you're just throwing stuff against the wall and seeing what sticks, like the odd time you might get it right, but like how do you reproduce that? So it sounds so simple. Like I almost feel silly bringing it up every time I bring it up, but we romantically talk, I guess, as naturopaths, as talking about root cause, but really like even a more sterile term you could use is like a precise assessment, and that's what this does. It makes it makes what you're doing more precise, because you can really narrow down where you think the issues are when you know how to feel things properly. Like for example, I'll do like the slightest little motion on someone's stomach. They'll be like, oh yeah, I feel that in my throat. So I'm like, see, now you know when you get some sort of throat uh, issue. That's a really common one, by the way. You just move the stomach like a millimeter with the right sort of force upwards. They'll feel it in their throat. It's like, well, now you're making a connection there that you may not have earlier. Or I'll move the stomach. They're like, oh, I feel that in my right way down here in my like where their ileocecal valve is. And you start to make some really cool connections. And again, the connection with the patient's really good because they know no one's really been able to feel their abdomen like this and put it together. And visceral information is kind of, it's diffuse too, right? Like well, we have examples of visceral pain, like when someone has a heart attack, right? That's visceral referral. And what is it like? What it's, we learn about it, and it's like, oh, it sort of feels like this, it feels like a this, it feels like a that. It's not really precise, right? So,
Right, it's like
or
if you have
gallbladder.
gallbladder issues, yeah, it's in your left shoulder. But you were also saying
Exactly.
a lot of back pain, chronic back pain, people that are going to chiropractors week after week actually have digestive issues, maybe. A lot of people.
Yeah. Okay, so that's why this boring this and the best of osteopathic visceral manipulation and applying it to a naturopath is so good, because when they go to the chiro, are they talking about poo? Maybe some chiros maybe do. When they go to the chiro, are they talking about uh, all the other aspects of health that you and me talk about with our patients all the time? Maybe, but in the hands of a naturopath who that's our thing. We got all these different tools in our belt and perspectives to view. Now, when you say, "Oh, I go to the chiro every week for a mid thoracic adjustment," every week,
Right.
like, come on, there's something else going on, and so maybe what they need to think about. And I'll tell you what in this clinic I work with some awesome chiros and physios, massage therapists. And so often if someone's back pain, I'm like, go to them first. Like that's their, like, go first. You don't get results within a reasonable period of time. Like you're going every week for 2 months, 3 months, you're missing something. So that's when I'd say, okay, then we can maybe look at it from our different perspectives. And it turns out that a lot of those pain pathways are shared between MSK or musculoskeletal and visceral afferents. So, and then we have a bias towards the more precise uh, MSK sensitivity. Meanwhile, it's coming from an organ, and they just share those information highways, and the signal gets sort of lost. And again, you go to chiro, it feels better for a day, because again, there's like a bi-directional thing. It might take a bit of stress off for a day, but that's not the cause. So I feel like there's a lot of mid-thoracic or neck pain. I mean, I could get into some specifics if you want, but yeah, that's what we're picking on the stomach today. I'll tell you that with the stomach, if someone's out there listening and they have like shoulder pain, or like sort of pain between the shoulder blades, and it feels kind of deep, and it's sort of like a gnawing, maddening pain, there's usually an autonomic component to visceral pain that can help you differentiate it from MSK pain. It's got this emotional sort of about it that is different than MSK specific pain. Like if I pinch my arm in a specific, I know exactly where I did it. It doesn't ruin my day.
Right.
You know, but when it's got this sort of like almost like an emotional response where you're just like, oh, I hate this pain. It's another indication that it's got a visceral component. So
I'm gonna run and buy some DGL after this talk. It's probably has something to do with all the coffee.
And yeah, and then it gets confusing, right? Because then maybe there's we talked about macro and micro, and maybe there's some micro irritation going on too. So then, the coffee, maybe opening that cardiac sphincter a little bit, or maybe increasing the acidity in the stomach, that makes the afferent sort of sensory input coming from the stomach like more, and it's like, yeah, it could be a bit of both.
What's it? Yeah, the inflammation is sort of sending alarm bells throughout the whole nervous system, going abort, like fire, fire, fire. There's an issue.
Yeah.
Here. Yeah. And that's sort of where the talk began, where you were like, yeah, I mean, this input from the organs and then input from your environment. So you're like, oh, I have all these issues with my husband, but my stomach's inflamed. And you're like, well, maybe, I don't know, you can see a marriage counselor, but then on the other hand, let me take some of the stress off your nervous system by addressing the organ inputs,
Yeah, but it's such a helpful thing to realize that might be part of the picture. And I'm very thankful for this training to get that insight, because then without the training, I don't think I'd even think of that. But you know how it is, like life is stressful, man. There's shit happens all the time, but if you can just take off, like, there's all these sayings like the straw that broke the camel's back and all that stuff. Sometimes you just need to take off a little bit of heat, and it can make a massive difference, so that they can go and then, see someone like you, or someone who deals more in the sort of mental, psychological sphere, to now they have the capacity to even address it. Whereas before they're just like, are we allowed to swear on this podcast?
Yeah, go ahead. We'll put you as explicit.
Okay. Well, they might just say, fuck it, I'm going to eat some chips and have a beer. Whereas now, maybe you've calmed down, just taking a little bit, maybe 10, 20% off the top. And now they're like, no, I'm going to sit down with my husband and actually plan like what we're going to do this week, so that, they might just have the capacity now that was just, they had no bandwidth before. Now they can do it without directly treating central nervous system in a way.
Right. It gives you more capacity to deal with that stuff. It's almost like you need to start maybe manufacturing some bumper stickers that are like, if you don't like my driving, maybe you need a visceral assessment. You should be able to handle traffic if your guts are all in the right place,
But yeah, you talk about like resilience and things like that. You can't not have any stress, but just that little bit can make such a big difference.
Well, it's like, yeah, like, I mean, if your stomach feels terrible, if you feel physically unwell, and then life throws some crap at you, it's, it's not going to go well.
Yeah.
Give you a headache, and and then that person's voice who you normally tolerate, now it's just like nails on a chalkboard, right? You know, so I think
your capacity to deal with that stuff might be improved. And like you said, it's modest. It's modest in terms of like, uh, I'm not trying to cure someone's life, but I am trying to do a bit of martial arts in a way that it's like a little bit of force or a little bit of stimulus that makes a big change. And by the way, the visceral stuff is kind of like martial arts in a way, in that like I've seen some really rough. So when we're talking about visceral manipulation, like I have seen some rough stuff. Like usually, I don't want to throw anyone under the bus, but I've seen a lot of like chiros doing like really rough visceral manips. I'm like, well, you do not need to do that. So I'm
mm,
uh, I'm going to make a plug here for anyone who wants to address that, to see someone who's been trained in a more of an osteopathic, which is a more gentle, beautiful, elegant, deeper, I would say, um, way of going about it. Because there's, like, for example, like I talked about the pancreas, we're sort of picking on the pancreas. Well, you have to be careful with it. It is a fragile organ without a strong capsule.
right.
So if someone's reefing on your stomach, that's
Mm,
attached to the pancreas. It's also attached to the spleen, which is also a bit fragile, right? So
right. Yeah. And I was actually curious too what you find when you start working with the organs. You were mentioning like people feel these referred sensations, but what emotions sort of come up? Like, have you seen that where you start working on their small
ooh, great
intestine or like,
question.
yeah.
Yeah, it's a great question. And we're told that, like, when we get the training, that people can, like, start laughing, crying, um, from just stuff happening in the organs. And I'm like, I'm a nerd, so I'm like, how the what is happening there? But there are, and I don't know that, maybe a top neurosurgeon would understand better, but there are afferents that come from the organs into certain emotional centers in the brain, and then some wacky stuff happens, and you can get some sort of release that happens. Generally, what I would say is that people just feel like, people often fall asleep or like start snoring when I do it. So like that's not going to happen if someone's reefing on your gut. It doesn't need to be like that. And I would argue that that's sort of like a non-specific good response when you're able to just completely let go and sleep on a treatment table.
Mhm.
You may have had that with acupuncture in the past, or whatever. The same sort of thing can happen with this. So I've had someone, I think someone cry. I had someone cry right after doing it. She cried like all the way home, and someone started laughing once. But it doesn't happen all the time at this point. But it does happen.
Mhm. Especially like, I mean, in Chinese medicine, all the organs are connected to emotions. And so large intestine is like grief, letting go. And so I'm just curious, yeah, like if when you start, you know, sometimes there's this, like, again, the top down affecting the elimination of the organ. And then we start working bottom up. Does that shift the emotional state? And
Yeah, I
yeah.
mean, again, that's so cool that Chinese medicine has these constructs in place, and again, I'm critical of. I don't just I like the Bruce Lee aspect of things. Take what like from tradition and the past, take what you want and what makes sense to you, and really throw out what doesn't work for you, and be open to bringing in new stuff. This has actually made me have to do the opposite and have to like go, okay, they were totally onto it. And when you have, that's when having that perspective of the hands-on, and it's sort of like instantaneous, right? That's something nice about that too, right? When you do something and you instantaneously can make that connection, uh, that's really cool. That's a really cool aspect of the hands-on stuff too. But yeah, the connection between emotions and organs has been there. It's been like you said, it was observed a long time ago. But to like confirm it with some hands-on stuff is is a whole other level. And what I have seen that did we talk? I don't know if we talked about this in school, but I've seen colon issues like colitis and things like that, usually or often. I shouldn't say usually, often related to some like family, some deep sort of family trauma or something like that. That is one that I've seen, the large intestine and like split in the family or something, maybe some sexual trauma or some trauma like that.
Interesting. Yeah. Some sort of
Hmm.
guarding, like an abdominal guarding that, sort of not fully well, again, it's like letting go. So
Yeah.
you've had issues with abandonment or some deep trauma, intergenerational trauma, to fully let go and feel safe. It's understandable
Yeah.
that someone wouldn't easily be able to do that.
Yeah, I don't, and again, I don't pretend to be, I don't have the wisdom to talk about that. Maybe like someone like you or someone who's more gifted in those areas. I just observe the relation and go, there's something there. But
Mm-hmm.
yeah,
Do you share that with them, or are you sort of like, oh, something here's in your colon? And they're like, oh, you know what? My dad left, when I was 5.
it doesn't normally happen. Like the couple I've noticed have been they've come in and just sort of taken their case, like like you would take their case, and then we get it hands on, and then you notice things after, not necessarily like you do it and in the act of moving something or mobilizing something. I don't necessarily see it that way, but you look after and you go, there's a couple correlations there that you can't ignore. And they happen in practice. You see like the same thing like 3-4 times in the day. Sometimes you're like, okay, remember that one.
Yeah, right. Where like people come in groups. They're like, oh,
Yeah, it's bizarre, right? It
yeah.
happens.
Yeah, it's very interesting. Yeah, and what happens is sort of like when the wind blows, everybody with PMS comes in that day or something.
Yeah. Yeah, I
Yeah,
prescribed natrum carbonicum, I think 3 times, uh like the homeopathic 3 times in a day last week. And I'm like, I don't prescribe that one all the time. It's very
bunch
strange.
of head
So
injuries came in. Or
no, they're like it's anxiety, and
okay,
and again there might be. So this is another thing in my big plans is to try and inform homeopathic prescriptions with more physiological, reliable symptomatology that I feel, and see if that fits with the traditional use of that homeopathic. Because I mean, homeopathy is talk about like a misunderstood, like the redheaded stepchild of even naturopathic medicine,
I know.
and it's got all these, it's phenomenology like we've been talking about, like you see this thing and you think it's this thing, but there's a bit of guessing. And if you act like there's not a bit of guessing, then I think you're lying. Not guessing, but there's a bit of like it's a bit of art in terms of like trying to, and a lot of it's subjective and based on what you know and bias. So
Right.
um
Right.
so, and I consider myself like fairly handy at homeopathy, and I'd have to say that that's still the case. Like it's not as grounded all the time, although pulsatilla seems to be always for temporal bone, ear stuff. And as I get a little bit more involved in cranial sacral therapy, I may have more to say about that, but it's a reliable one that
Mm-hmm.
way. We have some reliable ones, but I would love to be able to um, inform homeopathic prescriptions better, because that medicine is wild. It's the best when it works,
Yeah.
but it's just not as reliable.
Right. Yeah. My dog is pulsatilla, actually.
Oh yeah?
A
And what's
classic
the
case.
symptoms? What's the symptoms?
Like actually, he does have jaw issues. Like he just had a couple of
Interesting.
dental removals in the last couple of
Mm-hmm.
weeks. But he's super like cries all the time, big sad eyes. He's always like, and like just mopey, and he wants to be outside, and he's anxious and wants
Yeah.
cuddles, and yeah, everybody's like, he's pulsatilla. Everyone who knows, yeah.
And it works for him, right? It gives him some
Yeah,
benefit.
sometimes like a couple of pellets in the water dish. Sometimes, yeah, like
Yeah.
when he's having night anxiety and stuff, it's like, pretty good.
Yeah.
Yeah, yeah, it's a good constitutional for dogs.
It's amazing that it even works for dogs, right? Like, so if people say
Right.
it's all placebo, it's like, well, I don't think the dog saw me slip this into his water.
Right. Or knew what it was and was like, I guess
Yeah.
I'll just resolve that issue that she's
Yeah.
annoyed with, you know?
She's definitely trying to help me. I know that remedy. It's
Yeah, exactly. Yeah.
So
No, yeah, it's so interesting. Yeah, with homeopathy again, yeah, I kind of like um shy away from that conversation because I just don't know what to make of it. Like I definitely taking remedies and I'm always
yeah,
like in our little dispensary, like, you know, throwing back some pellets, like, diagnosing
yeah,
myself. But in terms of, and then, yeah, with patients, but it's kind of like an aside. So here's your treatment plan and here's a couple pellets of Natmir or something, as instead of a central remedy. But
but
then, yeah,
see that that's what most of us do, and
yeah,
that's why it won't really progress in our uh, awesome profession, because it does kind of get that backseat. I make analogies for everything. I think it's kind of like if you're up to bat and it's like swinging for the fences. When you go for a homeopathic, and you're going to strike out a lot when you swing for the fences, right? You're not playing small ball trying to get on base. You're going for the grand slam, and it's hard because nothing hits it out of the park like a homeopathic if you hit it out of the park, but ready for some strikeouts. And that's because I don't think we have the grounded understanding of how and where it works. And that's why I think that's one of my things I'd like to do is try and like find out what are the organs that are definitely um, implicated when a remedy is needed. And if it goes with the traditional use of that remedy, then we need to improve our understanding of that remedy, and probably shrink our remedies that we use, like the number of remedies that we use, and really try and understand them better.
right,
uh,
right. Yeah, like one might have with an herbal dispensary. So there's like thousands of remedies, but maybe in a typical naturopath's like their herbal friends maybe like in the hundreds,
mm-hmm,
dozens maybe.
mm-hmm.
But with homeopathics, it's like if you're doing it the traditional way, you can come up with, like, I mean, there's thousands, so it could be any one. So really like working with a few. Yeah, it's tough. Like I think it's that confidence piece for me. It's like, do I dare prescribe
Yeah,
homeopathy for this?
yeah, and I don't blame you, because you're trying to give, the pressure's on. You're
Mhm.
trying to give a reliable, reproducible result to people as much as you
Mhm.
can. And
Yeah.
so often it doesn't, unless it's a home run, like that, someone threw you up a meatball and you're going to spank it out of the park. There's very few remedies like that. I would say pulsatilla is one of the few that are like that. Then it does get, it's an accoutrement, it's sort of like, it's on the side, it's the parsley on the side.
Right.
Um,
Yeah, exactly. That's what it is. It's like a little bit of like a
mhm.
dab of salt, a little pinch of salt at
But
the end.
then it might be the thing that completely changes their life. And I've seen it enough times that I still use it. But yeah, if we can, like, some of the remedies, uh, could their action could be informed by some of this visceral stuff. Like, do you remember sanguinaria is a liver remedy,
Mm.
and it's got right shoulder and neck pain, and that's because liver, when it's irritated, and the liver abuts the diaphragm. So the diaphragm, anything diaphragm is like phrenic. So the phrenic nerve innervates the diaphragm, and so sensory information from an irritated liver, which irritates then the diaphragm, goes up to C345 in the neck, and that also innervates the shoulder and neck. So now you're getting visceral referral as a confirmation that that remedy might be indicated for liver issues. So there's going to be some remedies that I think we can make get a better understanding with understanding, like anatomy and visceral referral patterns, I think.
Mm-hmm.
Hmm.
It's interesting because the way I prescribe herbs or think of herbs is more in the micro level. I'm thinking like what are the biochemical imbalances or what are the cellular abnormalities that I'm trying to treat, and then what
Hmm.
herb kind of aligns with that, or maybe even energetic patterns like mental emotional patterns too. But homeopathy, like I don't know if I ever really prescribe herbs based on structural indications,
Hmm.
unless it's like pain, but then I'm thinking of inflammation, so I'm prescribing anti-inflammatory or things that maybe reinforce cartilage or whatever,
Hmm.
but not like thinking of organ systems in that way, that you're thinking about them where you're like, oh, this it's liver because there's referred pain and this is going to help shift alignment almost, from a structural perspective.
Mm-hmm. And then when the structure is improved, it's implied probably that the function will be improved, right? Like,
Mm,
why is a wheel round? Well, to do its job, right? Like, there's structure and function is everywhere. Why is,
mm,
why are those cells in the gut shaped the way they are? Well, to do the function that they do. And if they get mangled, like in leaky gut, they lose all their shape and villi. They don't do the job as well. So again, applying that, we have that understanding on the micro level. We just have to sort of say, well, get the telescope out or get the microscope out. It's the same. It's the same sort of phenomenon or principle.
right. Yeah.
Mm-hmm.
So interesting. Yeah. I want to learn about this now. I'm like missing so much because yeah, I mean that's
Well, we're
also
the gut people, right, Talia? Like,
yeah,
we really are. Like,
it's true. Yeah.
so I think I'm happy to hear you say that, because um, I feel like we really could do better. So maybe, in the future, I'll try and teach some sort of, at least the assessment. I don't know if I cleared up that thought that we had started a little while ago. It was the osteopathic stuff I've learned has contributed so much to the proper assessment, which means treatments get better. And I'm not using like crazy number of different treatments, but because my assessment is so much more reliable, the treatment is more reliable. And I think that's maybe where we could do even better in terms of teaching how to examine the abdomen with an osteopathic informed approach. Yeah,
Right. Well, yeah, if you're identifying, okay, the problem is stomach, that narrows down the potential therapies or supplements you would even consider. Like, okay,
exactly.
DGL. DGL is a good one to start with, and then you're going to get improvement because you know it's stomach related. But
And
yeah,
it's reliable, and we sort of know how it works.
mhm,
Like, it's reliable, and I think that's, as a sort of like anxious person who really wants, I want reliable, like, and that sort of came through in practice, is that even if I did well, I'm never happy with like doing okay,
yeah,
and so I wanted always reliable stuff, even though we do all right. I think you always have to have the mindset of I could do better, and be aware of your sort of blinded spots, or spots that you just haven't looked into.
mhm.
um
I mean, that's
yeah,
the beauty of our medicine because we can always go further. I don't think we're limited by, I was talking, not knocking the medical profession at all. In fact, the owner of my clinic is an MD,
hmm,
but I think, a general practitioner is trained to refer, and then the specialists they're extremely focused on the conditions that they see. And if you come in and you don't fit into those diagnostic categories for those specialized conditions, they're sort of like, end of the line. So like a friend, and I know you asked, I think it was to your social media, you're like, what are the most hilarious things you've been told by a gastroenterologist about your IBS? And
hmm.
one of my friends actually, so he waited for 6 months to see a GI. And the
Yeah.
GI like he hands him a pamphlet that says diet does not affect this condition at all, looks at him square in the eye and goes, you have IBS, completely serious, deadpan face. You cannot die from this.
Wow.
Don't worry, you can't die from this. There's no cure.
Wow.
You're gonna have to take days off of work because you're gonna have chronic diarrhea for a reason that you're not
Yeah,
gonna
yeah.
understand. Diet doesn't help. Diet's good for health generally, but not for this condition. And my friend was like,
Wow.
yeah, he's like, natural medicine was the only thing that helped. So he's essentially sent home disappointed, and then left to Dr. Google things. And it's like you could see a general ND, and maybe like someone like me who's maybe not super focused on gut but has some knowledge, and we might, okay, let's tweak diet, let's add some supplements. And then if that's not enough, seeing someone like you or going directly to you, and there's even more perspective that you can gain, and it doesn't end, which can be frustrating for patients, but it also provides that like the hallway of doors you can walk through continues to go and go and go, and eventually there might be an answer.
Hmm. No, it's funny, like you say that about, you're not an expert in gut, but like I will have to give a plug to all naturopaths are good at working with the gut.
Mm.
And it's ironic in a way that a lot of my referrals come from another naturopath, which is Kara, my
Mm.
who owns another clinic that I work at. And it's funny because she could probably handle guts better than anyone who comes, or better than most, right? Because a naturopath, but it takes knowing a lot about something to know that there's maybe someone who knows even more.
Mm.
And that's sort of like the irony. But yeah, like any naturopath is going to be able to give you the basics of um, foundational gut things. Then the fact that a gastroenterologist who's been trained, like, what is that, 10, how many years of training is that, 10
Yeah, at
more?
least 5, but yeah.
Like,
Mm-hmm.
that is just, I mean, again, I guess I'm getting older, so I'll just say whatever, but like, I'm sort of done with being too nice, but that's like, to me, that's like borderline malpractice.
Mm.
To say that food has nothing to do with IBS
Mm.
is like, that's just so blatantly wrong and
Mm.
harmful on a big level. When an expert like that, this person is probably extremely intelligent and very, very influential.
Well, this is the
In
head kingpin of gut, right? Like you would say, oh, the GI rules over the NDs and the whoever, right?
Yeah.
Mm-hmm.
And to me, I mean, that's gotta change. That is just like, that's horrendous. And plus, here's the best part: if they say that, here's my favorite thing that can happen. Sometimes they'll say that, and then they'll say, "But take this pill." And I'm like, "Well, where does the pill go?" "Oh, into your gut." "Oh, through your digestive system, the same place the food is." "Right, got it."
Right.
Like,
Yeah. Yeah, you're relying on absorption. Yeah, I mean, like, and it's interesting because when somebody says food has nothing to do with it, it is like, okay, so is it because there are negative studies on food? What did you look at? You know, how did you test? And or are you just saying that we just haven't tested it, and so we're just saying it has something to do with it? But it's like, you know, it's as if you walked around with a blindfold all your life, and you're like, well, there's no proof that the sky is blue. It's like, well, have you tried
mm-hmm,
looking at it, right?
mm-hmm,
So yeah, I mean, we know the low FODMAP diet is something that's prescribed. It's usually kind of like a handout, like here, don't eat these foods. And then there's
mm-hmm,
not really a timeline given. People are like, okay, I can't
mm-hmm,
eat garlic anymore, apples.
mm-hmm,
Um, but yeah, I mean, that's just one part of the story. It's like, these are foods that are the bacteria in your gut are eating, and some of those bacteria may be beneficial, and they're fermenting these foods, and you don't like the effects of that fermentation. So let's just starve them, you know?
mm-hmm.
But it's not
Including
really
the good ones.
exactly. Yeah, exactly. Because all the foods that you're supposed to avoid are also beneficial foods. You know, they're all on all the lists of beneficial fibers and things. So yeah, it's a tricky one. That's where gut can be this difficult thing. Like when a patient comes in with IBS, it's sort of like we have a lot of conversations around where we're going to start, you know,
Yeah.
um, in terms of, yeah, like, are we just gonna, because a lot of people get better with just bitter herbs, but then a lot come back, and then it's like, okay, now we got to start looking at food you're eating, or so it's kind of working in layers in that way, but it can be a long drawn out process. So I haven't refined my approach in that way.
Mm-hmm. Well, I mean, and look, this isn't your first year in practice. You've been doing this a little while, and you have all the training and everything that is possible, and it sounds like you're pretty good at it. So that says a lot. That means there's a lot of room that we can improve in. But one thing I'll say is that back to the testing thing, like you could have. I feel like we have a lot of like push for SIBO, like this whole idea of SIBO testing, small intestinal bacterial overgrowth, and I think I've done a total of like 2 tests ever.
Same.
Pardon?
Same. Yeah, only two.
Yeah, yeah. Well, I was like, something doesn't feel right about it. Like it's quite expensive to just have it like a baseline,
Yeah.
and then we have to test after that,
Right.
and then we have to monitor treatment after that. So we're getting into like $1,000 to sort of monitor treatment,
For
which
just one condition, you know, and if you're going
yeah,
with that condition, my thoughts have, sorry to interrupt you, but my thoughts have all been like, well, if we're going to order a $200 test, it means we're already assuming it's that. So my internal algorithm is saying like, why don't we just try and sort of treat it, you know?
exactly,
Yeah.
exactly. And then you have to look at it in terms of well, one of the things I like to communicate with patients and people in general is that why does anything live where it lives? It lives where it lives because it gets what it wants. There's less of what it doesn't want, and it's got this sort of environment that it wants to be in. Maybe structurally too. Like there's certain bacteria live at the in terms of cavities in the mouth. Some live by the gums, some live in the cavities away from the gums. Like they pick their environment. So if we're talking about like SIBO, like little bugs that live in our guts, we have to go, why is the environment such that they are living there? And so, I mean, you can throw all the herb down the tube you want, but if the environmental conditions are not addressed, the same squatters are going to come in and sit there. And there's many different ways to affect environment. And if the macro view is not addressed, you are completely missing a possible major contributor to the reason that those bugs even sit there. So maybe you've got like strictures or like fascial restrictions in the small intestines, which mean less oxygen, less blood flow. Then the bacteria that live there, they reproduce slowly, so they secrete things that make the intestinal transit slower. And if you don't address the big macro structural stuff, or like your bile duct, the valve, the sphincter vodi that allows bile into the duodenum, say that doesn't work properly. Well, you can take as many choleretics as you want. You can do all that's, you can take as much stuff as you want, but if the bile is not getting in there and doing its job, you're going to have malabsorption of fat. You're going to have less antimicrobial influence. Like the macro structural stuff is just so we already said F, so it's so fucking important. I I can't overemphasize. If your stomach doesn't the pylorus, if it doesn't open and close properly, and these are under autonomic influence, so like the work that you do with people can have massive effects on all those sphincters and junctions, because they're highly autonomic sort of reflexogenic points. And if you're stressed, those sphincters don't work properly. And I think even Tanya Lee, who's a great clinician, Tanya Lee, we've had her on before.
Yeah.
On our podcast. She's wonderful. She just like, she had someone with SIBO, and she's like, she gave them some herbs and some stuff to like get them to calm down, and like SIBO went away. So the focus of SIBO being brain to butt is important too, but the focus of SIBO just chasing the end result of conditions that preceded why the bugs want to be there. That's the possible problem. That's one of the possible problems with it.
Yeah, because you still have to backtrack from SIBO. So you've run the test, you've confirmed, let's say, again, the test doesn't confirm every possible kind of SIBO. You have some evidence for SIBO, and then you're like, well, is it bile? Like you're not excreting bile, and so therefore the intestine pH is out of whack. There's no motility. So you're thinking like, okay, and then even if you narrow it down to gallbladder function, what is it? Is it that your bile is too sludgy, or is it the sphincter of Oddi? So then you have to be more precise, like you said. So when we're looking at root cause, the assessment precision. Maybe should change that. Yeah. It's like, it's kind of like leaky gut versus intestinal permeability, right?
Exactly.
Versus HPA axis dysfunction. Is like assessment precision. That's the new root cause term.
It's less beautiful, but it's more, it is precise.
Allows us to be validated.
Well, and I don't, it's different. Yeah, it is different language. I love, like we just had Rich Vuksanich on the That Naturopathic podcast. We just recorded with him, and he's like so rootsy naturopath, and I love all that stuff. I absolutely, like, he is so rootsy. Like, you'll love his episode, I think, because he's just like, he's got like the naturopathic fully equipped home. Like there's no EMF anywhere. He's got like R100 walls and like tiny north facing windows and big south facing, and he's gonna do permaculture there. Like he's the most rootsy naturopath herb guy ever, and I love that. But my brain more works that other way of sort of like, okay, assessment precision. I don't know. We all have just different ways of
Well, I think you're probably like me, where it's like I want to just do everything. Like I want to flip your tarot cards, but then also like talk about your biochemistry. And like it's kind of like jumping, like a leapfrogging or lily padding to all the different. Yeah. Oh yeah, tell me about your dreams. And oh yeah, here's like, you know, an herb is going to optimize your
yeah.
you know,
Well, that's
corticoid resistance. Yeah.
that's why it's hard sometimes to, like, you know, market to people what you do, right? Because basically you do so many things, and that's hard for people to sometimes comprehend, because when you do many things they think you don't do anything. Sometimes that's just psychology. But it does make it like your reputation just gets good from, you know, getting good results and all that, so it's fine. But it also means, as a naturopath, I think we have like, it's never going to be dull. It is
No.
it is never ever going to be dull. And I bet you we're good conversationalists.
I think that's why we have so many podcasts, because it's really just, I mean, it's interesting. Yeah, people have been listening to. So yeah, I'm going to plug That Naturopathic Podcast. If you guys are done listening to all the Good Mood podcast episodes, switch over to TNP and listen to episode 14. we
Taming the tiger.
Yeah, Taming the tiger. But yeah,
Got a
it's
lot of
very
hits,
easy.
by the way. Got a lot of hits, Taming the tiger.
Did
Just
it?
saying.
Yeah. I don't even know. I don't know. Yeah, I mean, I have to talk stats after this, because I have no idea how to gauge like if I'm doing well or not. But it's like, but yeah. So, I mean, I think that's why. Yeah, because we're trained to have conversations and to be curious and to keep asking questions, and so it's like easier to have a podcast. You're like just doing the same kind of thing, except
We keep asking why, right? We
yeah,
keep asking why.
yeah.
And that's been like in the conventional medicine approach. Again, I'm not slamming it. It's got so many, like, I applied for medical school after naturopathic school. Like I was going to do it. There's so many strengths about it. So I'm not, but I'm critical of, I'm hopefully giving like good criticism of, I do it to myself. That's why I try to get better all the time. It's not like it's not bad. I'm just saying they don't always go very deep in terms of like trying to get to the core of what's going on. So, and your naturopath will, right? And that's it's sometimes hard work, but man, it's fulfilling. It's fulfilling and beautiful work too. So we'll keep asking why and keep trying to get better all the time.
Yeah, keep following why down the rabbit hole, right?
Mm-hmm.
Yeah. And then acquiring new tools and different ways of assessing situations so you can get that precise assessment, traveling down to the roots.
Or root cause.
Yeah. And then you're like, oh, and the roots are informed by the mycelial network. So we're beyond roots now to soil microbes, and now we're at the Earth's crust.
Rich talked about that.
Oh yeah.
That's the microbiome, the
I'm
earth and
definitely
all
listening to
that.
that episode. What number is that?
I forgot. This one we just did, so it won't be released for like a month or just over a month. But I think I know why root cause triggers me to be a little bit more precise. It's because the philosopher in me into metaphysics and all that stuff. I'm like, I don't think we know root cause of anything. So that's why I'm a little sensitive to it. Like when I think of root cause, like I had a invasive melanoma a few years ago, and like it was like, why? You know, did I deserve it? Is it like in the cards that I had to have this, or whatever? So I think that's why I shy away from root cause as opposed to more modest goal of getting as close as possible to the trunk or whatever.
The relevant whys, right? Yeah. Yeah, because it's like, well, who created God, or what came before the Big Bang?
Don't get me started on that. That's a whole other issue. The whole, yeah. Right. I love metaphysics, but yeah, we're not going there now.
That'll be the next episode. Just like, how does metaphysics relate to your mood? Well, let's ask why. Yeah. Oh, this is great, Dave. So anything you want to leave off on? I'm definitely going to send people to the Naturopathic Podcast and your website, and so they can find you. You're practicing in Southampton, I think.
I'm in Port Elgin half the time, and I'm in Owen Sound with Dr. Kara half the time. But I think the best thing, because if you leave too many things, I think people don't really understand. I think the best thing I'd like to do is shunt everyone just to check out our podcast, That Naturopathic Podcast, because that's like a marketing love letter for our whole profession, and we bring on superstars like you and Rich and Paul Anderson and Tanya Lee, and just like we pick clinicians. We love good clinicians, and sort of showing the world how naturopaths think. And if everyone would just go check out That Naturopathic Podcast and maybe try and understand that the first few episodes we weren't as good at being hosts as we as we got to be, but like that is like what we're trying to show is the thinking process of good naturopaths, and or good naturopathic thinking processes is probably a more diplomatic way of saying it. And I think that's what the world needs. They need to understand how we think, because what we're seeing is people are sort of dissatisfied in a way with sort of a bare bones conventional approach, and they don't know yet how amazing doctors like you and Kara and Jordan Robertson and all these other naturopaths are. So just check out That Naturopathic Podcast, and that would be the best thing to do.
Best way to follow you. Yeah, it's such a good podcast. It's such a great service to the profession. It's really like gets us out there in such a legitimate way and a very clear way, because you're having really great conversations with clinicians, learning about their work, and talking about how they can help people, you know.
Mm-hmm.
Yeah, it's really good. I love it. Yeah, and I think
And
it was like, sorry, wasn't it like number 6 in podcast, like after Peter Attia? It's like Peter Attia.
We had a good run there. A good run there.
Oh no.
Yeah, it went down after that, but we have been up as high as number 6 on Canada Medicine Podcast. And you know, it's interesting because that's not based on like crazy high production. You know, like we just send it, cut it, that's it, here, put it out. It's very conversational, because it's me and Kara, and I think that helps because it's very conversational, so that's easy input to take in, and we have great people like you on, which is what it's all about. If you have good content, then you go up in those ratings. And I love that we went up. You know, we don't do it to be number 1, but hey, when it says you're number 6 behind like Mark Hyman, Peter Attia, and a couple other like heavy hitters, it's like, cool, we're doing something, and that's based only on merit, and that's based not on production and anything. It's just based on good content that we think people need to hear.
Yeah, it's so good.
Mm-hmm.
It's awesome. Yeah, it's definitely.
Mm-hmm.
I follow you. I rated you on Apple.
Yeah, thanks. Well, I'll do the same. And thank you so much for having me on your podcast too, which you are pumping it out.
Yeah, it was so easy to have conversations. My production is even lower than yours, but it's again, it's always, there's always room for improvement, and it's the same with being a better interviewer and host, and then figuring out how to edit the audio once it gets produced. But yeah, I mean, it's so easy because it's just like fun conversations that I book with people, and then I use Anchor, and Anchor is pretty user friendly. So yeah.
Well, it's fun to be on this side of the microphone, if that makes sense, or on this side, being the one interviewed. So thank you.
Exactly. I know, like each has its challenges, though, right? It's like.
It does.
Right, Dave. So thanks so much for joining me.
Yeah.
Take care.
Okay.